Bismillahirrahmanirrahim. The topic of our discussion is hepatitis B. So hepatitis B is caused by hepatitis B virus. Unlike hepatitis A virus, hepatitis B virus is a DNA virus and it is enveloped. Hepatitis B virus can result in either acute hepatitis or it may result in non-progressive chronic hepatitis. Non-progressive means it does not progress into end-stage liver disease or liver cirrhosis. Progressive chronic hepatitis means that the disease progresses to liver cirrhosis and end-stage liver disease. Hepatitis B virus infection can also result in acute liver failure due to massive necrosis of hepatocytes. It can also result in an asymptomatic carrier state. In asymptomatic carrier state, the infected individual exhibits no signs and symptoms of the disease but can transmit the virus to next person. The mode of transmission of hepatitis B virus is blood and body fluids. So it is a blood-borne disease. The mode of transmission varies in different regions. The high prevalence areas are Asia and Africa, where the prevalence of disease is more than 8%. The mode of transmission in high prevalence areas is mostly acquiring of the virus at birth from infected mothers. In intermittent areas, the prevalence is 2 to 7% of total population, and the areas include East and South Europe. The mode of transmission is mostly through the contact with broken skin, blood transfusion, and use of non-sterilized surgical equipment. The low prevalence areas include Western Europe and North America. The prevalence of hepatitis B infection in these areas is less than 2% of total population. The mode of transmission in low prevalence areas is unprotected intercourse and IV drug abuse. So the incubation period of hepatitis B virus is 2 to 26 weeks. Hepatitis B virus is acquired from the infected individuals through blood and body fluids. So once these hepatitis B virus enter the blood, they infect the hepatocytes. The damage to the hepatocytes is not because of the virus itself, but due to recruitment of CD8 T cells, also known as killer T cells. So these T cells recruited to the liver damage the infected hepatocytes, resulting in necrosis and liver damage. Hepatitis B virus infection can be either subclinical, it can cause acute hepatitis, and chronic hepatitis B. Almost 65% of cases of hepatitis B virus infection are subclinical and remain asymptomatic, whereas the incidence of acute hepatitis is almost 25%. Only 5 to 10% of the infection cases progress to chronic hepatitis B, out of which 20 to 30% cases further progress into end-stage liver disease or liver cirrhosis. Almost 2 to 3% of chronic hepatitis B infections progress into hepatocellular carcinoma. Hepatitis B virus results in hepatocellular carcinoma due to presence of a specific gene known as HBX gene. The signs and symptoms of hepatitis B include nausea and vomiting, which might also be accompanied by fever and loss of appetite, resulting in weakness. There might also be right hypochondrium pain, and the disease becomes noticeable because of jaundice. Jaundice becomes clinically significant when concentration of bilirubin rises above 2 to 3 milligrams per deciliter, resulting in yellow discoloration of sclera, skin, and mucous membrane. LFTs are also deranged, which is signified by increased levels of ALT and AST. ALP usually remains normal. So almost 5 to 10% of cases progress to chronic liver disease and cirrhosis, which is characterized by ascites, hematemesis, and other symptoms of liver cirrhosis, such as coagulopathy, encephalopathy, and portal hypertension. The serum markers for hepatitis B virus infection include hepatitis B surface antigen or HBS antigen. Hepatitis B surface antigen appears just before the onset of symptoms and may last up to 12 weeks or in certain cases, even 24 weeks of the onset of disease. So right after the hepatitis B surface antigen levels fall, anti-hepatitis B surface antibodies start to rise. So hepatitis B surface antibodies rise after the acute disease is over. In certain cases, hepatitis B surface antibodies become undetectable after even the disappearance of hepatitis B surface antigen. This period in which hepatitis B surface antibodies cannot be seen is known as window period. During the window period, diagnosis is established on detection of IgM hepatitis B core antibodies. Other serum markers include hepatitis B envelope antigen, HBe antigen, hepatitis B DNA, and DNA polymerase produced by hepatitis B virus. All these appear soon after the appearance of hepatitis B surface antigen in the blood, and they signify viral replication, which indicates infective state of hepatitis B virus. HBe antigen, hepatitis B DNA, and DNA polymerase also indicate progression to chronic hepatitis B infection. Other serum markers include anti-hepatitis B core antibodies or HBC antibody. These antibodies are IgM and they become detectable right after the onset of the symptoms. As the time passes, the IgM antibodies are replaced by IgG antibodies over a period of months. IgG antibodies last in the blood for years to lifelong. IgG antibodies cannot be titrated separately, so they are determined by the rise in hepatitis B core immunoglobulins and fall in IgM hepatitis B core antibodies. The vaccine for hepatitis B virus is available and it plays a major role in the prevention of hepatitis B infection in all ages. Moreover, interferons are also used for the treatment, and in acute hepatitis B, the treatment is only supportive, which includes administration of fluids, NSAIDs, and monitoring of liver function tests, including ALT and AST. The antiviral drugs used in the chronic hepatitis B infection include entecavir and tenofovir. One thing you need to remember is that before using these antiviral drugs, HIV must be ruled out. The objective of the treatment is seroversion of hepatitis B E antigen. Hepatitis B E antigen, as you may recall, denotes the viral replication, and decrease in HBe antigen denotes the effectiveness of the treatment. Next objective is to decrease the hepatitis B virus DNA and to normalize LFTs. Vaccination is given in 3 steps at day 0, day 30 and at 180 day. So this concludes our discussion about hepatitis B. If you have any questions, do let us know in the comment section. Thank you.